Okay, it is a continuation of the school health services. We have already finished what is a school health, right? What is a school? What is school health? What is a school health services, right? So school health services, just a review of that, is an important aspect of the community health. So it is possible to increase the health level of the community and achieve the growth in the health of future generations through we can achieve the health of future generations through the school health services only. Okay, now we have introduction. We told you that I have already told you that from age 5 to 15 years, 17 years of the school going children, and 30% of the population comprises of this age group. Okay, then we have already talked what is a school, what is school health, right? School health services. Then what are the school health services in India? Okay, we have already talked, right? Component now of school health services. Okay, now the first component will come the school environment. Okay, we have already talked about the school environment, right? Then we have also talked about the team. Wait, so we are going to speak about the aspect of school health services now. Okay, so in the aspect of school health services, this also can be called as a component of the school health services. Okay, now we are going to talk about the health appraisal of school children and school personnel. Now, what do you mean by the health appraisal of school children and school personnel? Okay, so what picture you can see here? What you can see? When we talk about the health appraisal of school children and school personnel, what do you see here? What they are doing in the picture?
Physical examination.
Yeah, that means they are doing periodical medical examination of the school going children. Or not only the school going children, they also do the physical exam for school personnel. Who are the school personnel? Those who are working in the school, that is teacher, anyone. Okay, so every medical examination should be done at the entry. At the entry means when they get first admission to the school at the age of 5. I think that time that medical examination should be done to all children. Okay, then routine physical examination need to be done also. Okay, got it? So they have to do the clinical examination for nutrition deficiency, then other testing like for feces, for blood. Sometimes they can do also go for the clinical examination from the school itself. Now, sometimes even the tuberculosis testing, screening for other diseases, for visions, all weight, height checking should be done. So, and also in health appraisals comes the daily monitoring inspection by the teacher of the children who are closely contact with the children. What they do morning inspection is like for sign and symptom like if a child is having a flush faced, rashes is there, spots are there, or any sign of coughing, sneezing, short throat, rigid neck, nausea, vomiting, headache, chill and fever, they have to do daily morning inspection of the child by the teachers. Okay, understood? So in the health appraisal of school children, school personnel, that means it is a periodically health checkup. Okay, then medical examination during that what do you call at the entry point, that is when they will come for the entry, when they'll come for admissions at the age of first admission. Then routine examination, physical examination should be done, periodical examination should be done, and daily morning inspection of the children should be done. Okay, yes.
Yes,
Yes,
ma'am.
ma'am.
Okay, that is known as the health appraisal of the school children and school personnel. Okay, now when we talk about the remedial measures and follow up, what do you mean by that? Same thing here also. Follow up means what? Doing following the regular examination, referral services. Then there should be a special clinics should be conducted in the health unit. That means in a health unit, a special a special clinic should be conducted in the health unit so that the children are examined um, periodically. Okay, so there should be some specialty also in the school should be employed so that they can get the um, any what to say the abnormal behaviors or the abnormal findings of the children. Then referable, if there is any, there should be a referable hospital for the children also. So they should provide a bed for the school for the children who are admitted, and they should also provide a relevant treatment for the school going children. Okay, this is the remedial measures and follow up they should do. Understood? Yes or no?
Yes, ma'am.
That is the remedial measures and follow up. Okay, now in the prevention of communicable disease, how you can prevent the communicable disease, tell me.
Frequent hand washing.
Okay,
Ma'am,
that is a
following
behavior. Okay, behavior. Okay, healthy behaviors. Okay, like washing, frequent washing of the hands. Then, for example, now, example of corona. Come on.
Wearing mask.
wearing mask, using
Okay.
sanitizer,
Hmm. Then what else can you think about? Anything?
social
No
distancing.
overcrowding.
Okay, beside this infections, corona infection, how they can, these children, how they can be prevented of this communicable disease? Anything measures are there?
Vaccination.
Yes, that is the immunization. Whatever immunization we are giving according to the national immunization schedule. Okay? Because nowadays, whenever we give an entry to the school going children first, we also see the immunization card. Okay, previously it was not like that. Nowadays they even see the immunization card. That's why we always advise the parents, please bring your immunization card and keep the immunization card properly, because they will be needing at the time of admission in the school. Okay, got it? And at the age of 10 years and 40 years, what vaccine is given? What we
Yes,
give?
ma'am.
What we give? What vaccine we give at the age of 10 years? We go to school health visit, right? To give something, some vaccines. What is that?
TD, ma'am.
TD, yes. At the age of 10 years and 14 years, 16 years, we give TD, right? Yes or no?
Yes, ma'am.
Yes, ma'am.
Okay. Now, next is helpful school environment. So, I have already told you about the helpful school environment, right? It should be away from the busy streets, busy places, okay? The building should be, I have already told you, okay? Because this good school environment always promotes physical, social, emotional health of the school going children. Okay, so this school should be the example place to reflect their, to reflect even the sanitation also. Understood? So I have already told you in the previous slide talking about the school should be away from railway station, railway lines, bus stand, marketplace, cinema. Proper ventilation and light should be there. Height of the room should not be less than 12 feet. Every student should get minimum of 10 to 15 square feet of the area. Floor should be clean, not slippery. There should be railing on the staircase and roofs. And toilet and 2 urinals for every 100 students. A separate arrangement for drinking water, wash basin, school. All I have told you, right? And it shouldn't be more than, the space should be more for more students. Okay, so class I told you. So these are uh, um, the environment, school environment. Okay, understood? So this should be the
Yes, ma'am.
example of the, they should
Yes,
also
ma'am.
reflect a good sanitation. School should reflect a good sanitation. Okay, so you have seen here, na, you have seen this picture. It looks very neat and clean, right? Yes, it should be very neat and
Yes,
clean,
ma'am.
and it should look for the small children, especially those who are in KG. The school should look very, the classroom should look very attractive and all. Okay. Now, in the nutrition service, what do you think in the nutrition service we can do? Do you remember anything about the nutrition service? Tell me. Any services
We
are
can
there?
check
Ma'am, there
BM.
is a
We can
provision.
check BM.
Huh? We can check what? BMI.
Yes, ma'am.
No, what I mean to say is uh, like nutrition services. You have heard of the nutrition services, right?
Yes, ma'am.
Midday.
Yes. Somebody is telling about the midday meal program. So why nutrition service is required for the children? For what purpose? Why it is needed?
Ma'am, better immunity.
Hmm? To grow immunity, what else? Okay, good nutrition, usually I told you, for the optimal health growth and development. Not only for health growth and development, but it is also for your educational achievement, okay? But also you should your education achievement through nutrition service, because unless and until you are strong enough, you are immune to many communicable diseases usually happens at the school. So in that way, you if you are not well, you will be having a poor performance. So it is nutrition service is also required for your education achievement. Okay, so I have told you the nutrition midday meal program was usually given in the school nowadays, right? It is only the practical solution, especially in the rural area. This is the midday meal program in the school is a practical solution to combat the malnutrition in the children, especially in the rural areas. Okay, understood now? Yes.
Yes, ma'am.
Yes, ma'am.
First aid and emergency care. Why is first aid and emergency care is required in the school? And what they have to arrange? Tell me. Is it required first aid and emergency care?
For accidental.
Yeah, when the students fall sick and when they're having any injury, when they're having any fall, the emergency care is required. We cannot call or we cannot take them to hospital directly, right? Means, I mean, it will take time, right? So first, it is very important in the school. There should be a proper arrangement of the first aid and emergency care in the school itself. Okay. Then lastly, they can afterwards they can just refer also the cases if there is more. But for the first aid, they can use. And who will do this first aid in emergency care? Every time the nurses and doctors are not there, right? So the school teacher themselves they have to have a training, proper training program during the in-service training program to prepare themselves to carry out all this emergency and first aid program. Okay. The school are responsible to give the teacher when they are having in-service education or program uh, to have this training program on the first and emergency care. Okay, so that they will prepare themselves to give emergency care whenever it is needed in the school. Okay. Yes.
Yes, ma'am.
Yes, ma'am.
Now mental health. So what is mental health? It is necessary mental health also for you.
Yes, ma'am.
Why the mental? Because
Yes, ma'am.
mental health is very important. I told you it is for the children. First time when they come to school, it is a very stressful environment for them, right? Peer pressures, teachers' pressures, environment, different environment. Okay, so many things are there. So this mental health is also very important because this mental health of the child will reflect or will affect the physical health and the learning process. Okay, now usually in what you say in the school we have what type of mental health problem we'll have in the school? Anyone? What are the many mental health problems the children used to face? Yes, students.
Anxiety, stress, depression.
Hmm.
Not able to identify one's problem.
Haha. I didn't get you.
Ma'am, like a person who is able to identify one's own problem and able to tackle like problems, situations.
Well, that's why no. What about the mental health problem? Just name the mental health problem, like suicide, anxiety. Okay. Any other thing?
Depression,
Depression. Any other things?
depression,
Childhood depression.
Hmm. In the school going children, you have seen many things. No, anything you have seen. You have been.
adaptability problem,
Maladjustment.
isolation. Yes.
Maladjustment. Okay. Depression. They may sometimes may go for depression. Juvenile delinquency also is there, right? Sometimes drug addiction is also there in school, right? Yes or no?
Yes,
Yes,
ma'am.
ma'am.
Yeah, drug addiction also, these are the main coming problem these days in school going children. So what we have to do in order to solve this problem of the mental health, so who are there in the school? Teachers, right? Teachers only, the people who are working there. They are the one. So principal, the teachers who are planning and doing all the activities in the school. So they are the one, they have to, they are there, they should, it's a need for them to plan and organize the well balanced curriculum activities, okay, so that the students are not overburdened, or they have a sufficient time for relaxation or recreation also at the same time, okay. Especially I'm talking about the school going children, I'm not talking about the professionals ones, okay, like you people, right? Okay, understood.
Yes, ma'am.
Yeah, we are
Yes,
sometimes,
ma'am.
yeah, in the professional we are sometimes overburdened, right? But especially in the school going children, we have to plan the curriculum activity in such a way they enjoy their studies, okay, and they have lots of time for recreations and relaxation techniques, okay. So they should not be overburdened, over stress, okay. They should not be stressed about their position also, okay. What is main important is the concept. They should be very clear of the concept only, okay. Whatever you study now also, whatever you study, uh, you have to be clear of your concept. When you are studying something, you don't think of the positions or something like that, okay. So your mental health also is very important when you are in this school, okay. Understood now?
Yes, ma'am.
You have undergone all these things, right? Parents pressure, teachers pressures, peer pressure, right?
Yes, ma'am.
Now dental health, you see, dental health is one of the very problem, usually school going to usually suffer from this dental disease and defects, okay. So this school health should incorporate with the dental health component also. So there should be one dental hygienist and dentist are to be employed in the school health program also, okay. So during the whenever they come for checkup, for the dental checkup, they should mainly focus on prophylactic cleansing and dental hygiene diseases. How they are going to do their how they will be able to clean. They usually when they give a health education, they should more focus on the how to do the prophylactic cleanings, and dental hygiene is very important. Okay, so that has to be more focusing on the children, school going children. Okay, because they are usually who suffer from all these dental diseases and defects, right? Right. So you can see the picture here.
Yes, ma'am.
You understand what this picture says?
Yes, ma'am.
Okay. Now, eye health services. Why eye health services needed in the school? Any problem?
Myopia and
What else?
metropia.
What else?
Metropia.
Then, very common.
Vitamin A deficiency.
Refractive error, squint, myopia. You have already told. So many of these children, they have a problem with the refractive errors. Okay, and even vitamin A deficiency, right? So what we should do now in the eye health services? What we will do in eye health services? Can we advise something for the eye health services?
Regular eye checkup.
Okay.
Then vitamin supplementation.
What is that supplementation? What is that
Vitamin
supplementation?
A.
Vitamin A, yes.
Then
Vitamin A administration is very important, okay? So even if they have some very serious eye problem, they should be they should refer to other health unit for a checkup, okay? So any other like squint or refractive error, they should be doing their periodic checkup and they should be referred to somewhere else in the health unit. Okay? Yes? So periodic eye checkup should always be there for the school going children. Health education. What health education will give to the school going children? Many of what? Why we are giving health education to the school children? Why you want to give health education to the school going children? Why?
To create awareness.
And regarding what? To create awareness regarding what?
Health problems.
and its management.
So that when you give health education, there you are creating awareness. And when they are aware, they are motivated, right? And they will change their healthy attitude and healthy behavior towards health, right? Yes. Yes or no?
Yes, ma'am.
So health education, what a topic we can give them? For example, regarding, I told you so many problems.
Hygiene,
Hygiene, first of all, hygiene, then comes
dental,
dental,
nutrition.
environment, nutrition, all those the aspects of the whatever I've shown you, the components of the school health services. Okay, so you can give all those and also at the same time communicable and non-communicable diseases also we should give some health talk to them. Okay, sometimes about the sex educations also we can give so that they be aware of all those things. Okay, for the communicable diseases also. Okay, yes.
Yes,
Yes,
ma'am.
ma'am.
So we have that what to say, handicapped children. So what we are supposed to do with the handicapped children?
Give them psychological support.
And what else? Psychological support we will always give them because they are always have that inferiority complex, right? But giving a psychological support only doesn't will help, but it also irrespective of all their what to say, their disability, we also should motivate them to become what you call self-supporting. Okay, and so that they can do as the other children can do it. Okay, got it? They have to be same like the normal children. We cannot what to say, discriminate them because they are handicapped. Instead we should encourage them, motivate them to be more functional, as well as it should be same with the other children. The achievement also should be same with the other children also. Okay, okay, they should be independent for themselves. Understood? Yes.
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
So now we have a school health records. Why we need a school health records? Every time we know whatever we do, we have to keep record, right? Report and records, right? So here what will help us as a, so we should always keep a record of the any individual, of every individual. Okay, report and recording is very important. I told you documentation is very important so that it will serve us because we are giving school health services. This will give us that at least we have done this. Okay, this can give us that we have done this services to the school going children, and we also can see, we can evaluate it and see whether there is any improvement in the school health services we have given, or there is no improvement in school health services, so that we can have a proper way of thinking again to improve their services. So many things we can do with the records, right? So we have to see first, we have to record it. Each individual's records and report should be there. If any case, if it is whether we are successful or not, if you are successful is fine. If you are not successful, what are the ways and means to be successful in the school health services? So these are the tools we can evaluate it. Understood? Yes. This will help out to the for the evaluation. Evaluation means whether it is successful or not. If successful, fine, but we have to maintain that, and if not, we have what are the ways and means to improve it. Okay, got it? So we have lots of components or aspects of the school health. First is health apprise of school going children and school personnel. Then we have remedial measures and follow-up, prevention of communicable diseases, healthful school environment, nutrition services, First aid in emergency care, you just remember the teacher has to be well trained for the first aid in emergency care, okay? Mental health, I told you, juvenile delinquencies, anxiety, stress, drug addict, so many people, so many problems are there. So we have to find the ways and means so that we can, the teacher has to plan the curriculum properly so there is no burden for them for the studies, as well as they get lots of time for recreations and relaxations, okay? So dental health, they are very, children are very, they are always have this problem. So we have to focus more on dental hygiene, okay, and periodically check up also. Once it is written somewhere, I saw that chart in Pamlum Pizza, I think 2 minutes twice a day. Have you seen that chart? In Pamlum Pizza, will have to keep your teeth healthy, something like that. Have you seen the chart? That means whenever we cleanse our teeth, at least 2 minutes time should be given, okay, and twice a day. Yes?
Yes,
Yes,
ma'am.
ma'am.
Why you just keep quiet like that? Have you not seen the chart there in the problem PHC when you went there? Yes or no?
Yes, ma'am. We have seen, ma'am.
Okay. Now, eye health services and health education, then education of the handicapped children, and school health records. Okay. Now we are going to talk about the responsibility of community health nurse on the school health services. Now, I told you beginning and implementation. Now, before the beginning of school health services, nurse should collect the complete information about the school administration, about the students and teachers, available resources, school environment, facility of internal and sport. So before you do anything, whenever you go to school health services, you want to do some services in the school. So your duty is first to see you get a complete information. You cannot just go and give some services in the school, right? So we have to take complete information of what, how the school are running, who, how many students are there, who are the teachers, any resources are available there. Okay, what are the school environment? How is the school environment, and what is the facilities of any recreations or whatever. Okay, after doing all the surveys, completing, taking all the information, then only we can take some permission beforehand so that we can go and give some school health services. Okay, at the same time we also have to see what are the problems in the school they are facing. Okay, so necessary permission from school management beforehand is very important. Like we take before doing anything, we take the signature of the principal, right? Permission from the principal, right? So same here, we have to take a permission from the school management before we go for any school health services. Okay, this is a liaison between the school, home, and the community. So you see, there is always a communication between the school, the home, and the community. I have already told you, right? School, the parents also should be involved, the community also should be involved. There should be have a communications with them, so that we can run the school health services. Okay, and changes can be brought into school health program on the basis of information gathered from villages and homes. So even some information we can gather from the community also and from the parents also. So this, thinking about this, we can bring some changes in the school health program also. Okay, we should know what are the uh, villages are having problem with the schools or something problem in the schools, or maybe from the parents also. So those, according to that, whatever their needs, because it's a priority need based, right? School health service also a priority need based. So accordingly we can also give services according to that. Okay, so the information has to be collected even from the villages and from the parents. So as a teamwork, we always work in a team. We don't go alone, I told you. So there is, in our teamwork, whenever we give a school health service, doctor is there, teachers will be there, parents will be there, local headmen will be there to, so that we can give a good services. NGO will be involved there, volunteer organization also involves there. Okay, whenever we go for any school health services, even these NGOs and volunteer organizations, they help us to give uh, some health educations, or they want to voluntarily give some snacks or something like that. So coordinations is very important between this team. Okay, we have to work in coordinations with all the other teams. Okay, then only it can be a successful. Then evaluation, I know at last is the evaluation. First you do the implementation, after that whatever you have done After coordination and after implementation, they have not written about the implementation yet. So implementation is required according to need basis. You do, or you want to give them health education, you want to do demonstration, you want to do periodical health check or whatever. After that, the evaluation should be there. So evaluation is the last stage. Any services, health service, evaluation has to be done on the basis of different facts, documents, and information you have gathered. Okay, and whether you have to say whether it has any successful, you are successful or not. So also provides feedback on this service on the basis of the knowledge and experiences. So you also will get feedback whatever services you have given to them. Okay. Now, training and guidance. Training of teachers about daily checkup, maintaining health records, and providing first aid
Yes,
is
ma'am.
also important. So I told you, training and guidance is also very important. You also can give training to the teachers how to, especially how to give counseling to them um, whenever they're in the mental stress, and for the first aid and emergency care, all those things, and how to do the daily inspections of the children who are coming every day. Okay. So this training and guidance also is important for the teachers. Then providing assistance to psychiatrists in conducting child guidance clinics are part, because we told no, there should be one psychiatrist also in conducting it in the school unit, so that they can and you should also provide assistance to the psychiatrist, so that for in the program like guidance and counseling. Okay, this is one of your responsibility also as a CHN. Now, active participation, I told you, conduct primary health checkup for children, identifying the children who are at risk, providing treatment according to need-based, providing for, it should be according to standing order, okay? You cannot just give any treatment, whatever you like. So the standing order should be there. Standing order, you understood, na? You understood what is standing order?
Ma'am, like prescribed order.
हाँ, प्रेस्क्राइब तो प्रेस्क्राइब ही है, लेकिन स्टैंडिंग ऑर्डर का मतलब क्या है? You cannot prescribe anything, na? Can you prescribe anything?
Ma'am, standing order means like the protocol which have to be followed when in absence of doctor to
Yes, yes.
tackle the emergency situation.
Yes. So they have to follow the protocol, whatever it is given to the nurses to be taken. Okay. For example, in diarrhea, you should give this. So they have to follow that standing order. Okay. Because they cannot prescribe. Like for an example, like in STD clinics, we have that different packet, no? No, it's green packet, yellow packet. Some packets are there, right? In STD clinics, you have seen in STD who are suffering from STDs and all. Okay, there is some standing order for the STDs also. Okay, so they have a different packet for, if there's a mild STD, they have a different packet. If it's severe STD, they have different packets. Okay, and the sexual transmitted diseases I'm talking about. So these protocols are there when the doctors are not there, they can usually give. So that they should provide the treatment according to the standing orders in the for the school going children. Okay, then providing follow-up services and asserting the condition of school health service or visit the school from time to time. So it has to be ongoing process. The school health service also should be ongoing process. So you have to assess the condition of school health services by visiting. How we will do that? By visiting the school periodically. Okay, you have to go from time to time. Conducting and directing immunization program, we usually go for that. Trying to protect children from infectious diseases by giving health educations, by explaining about the demonstration of hand hygiene or everything. Assisting in maintaining a good environment at school. Conducting nutritional program, sometimes even nutrition program is also conducted in school. Conducting clinics related to children, so there is school health checkup also um, uh, by the medical teams. Conducting health education activities and maintaining the school health records. Okay. Okay. You understood
Yes,
now?
ma'am.
So today
Yes, ma'am.
what we have done? From the beginning you tell me what we have done. So what is the school health
Inspect
services?
school.
What is the school health services first of all? Bolo?
Need need-based comprehensive services that are rendered to the student
Hmm.
offers.
Okay. So we have so many problems, is right, with the school health. Okay, no need to talk about this school health problem. So main aim is to promote, protect and maintain the health of school going children, reduce the morbidity and mortality in them, right? This is the aim of school health services, okay? Then we have talked about the objective, the promotion of positive health, the prevention of disease, just a review, okay? Early diagnosis, treatment and follow-up of defects, awakening health consciousness in children, provisions of healthful environment. Then the goal is, I told you, we have to prepare the younger generation so that they remain healthy. When they remain healthy, they can make the best use, they can have the education achievements, and also they will have their they will enjoy the creation and develop the concept further, and the way they will also make the best use of their relaxation period in very productive and innovative manners. Okay, that is the goal. The need for school children, I told you. School health considered a very vital and substantial segment of population, and they are the vulnerable group because we should be very careful of them because of their physical, mental, emotional, social growth and developmental spirit, and they are exposed also to too many stressful conditions, environment, and they come from different economics, they belong to different socio-economic cultural background, and they have a very specific health problems for going children, okay? So philosophy of school health services is, I've told you, a healthy child is mentally alert, receptive. They will not miss the schools for simple things and they will have a better performance. So health is not just the freedom from sickness or infirmity, but the realization of the full potential of the child, which has a physical, mental, social and spiritual component. So prevention of the diseases at the right time, okay? They will also, the school will also identify any problem they are having. So the corrective therapeutic and rehabilitations can be given to them so that they can continue their studies. Now principle, I told you, it should be need based. It should be well planned with coordination with other team. So they should mainly emphasize the promotive and preventive aspects, okay? And health education should be given to improve the health, not only of the children, of all the staffs working there. It has to be ongoing and continuous program, I have told you, and they should always have an effective system of services. Then we have already talked about who are the teams, no need to talk about this. Then aspects we have already told, okay? So we have talked about the health appraisal of the school going children, remedial measures and follow-up, prevention of communicable diseases, healthful school environment, nutritional services, first and emergency care. We have talked about mental health, dental health, eye health, health education, education of the handicapped children, and poor maintenance and use of school records, okay? Proper maintenance, I mean. You understood or not?
Yes, ma'am.
It is very important topic, okay?
Yes, ma'am.
This is a very important topic, okay? So if you have understood, then that's okay. Thank you.